I will be talking about Nesiritide, a natriuretic hormone analog, and Angiotensin Neprilysin inhibitor, also known as ARNI, a newer treatment option in the management of heart failure. But before we go into the details of these drugs, it is important to know the different types of natriuretic peptides, the various functions, and how are they helpful in the management of heart failure. The natriuretic peptides are the family of peptides having a common 17 amino acid ring, and they are of three types: A type, B type, and C type of natriuretic peptide. The A type of natriuretic peptide is secreted in response to atrial dilatation. It is also known as atrial natriuretic factor, and as the name itself is suggestive, it causes natriuresis. The B type of natriuretic peptide is released by the ventricular myocardium in response to ventricular dilatation when the end diastolic volume increases or when the end diastolic pressure increases. So, plasma level measurement of brain natriuretic peptide is indicative of heart failure. The concentration of BNP levels correlate with the severity of heart failure. More severe is the heart failure, higher the concentration of brain natriuretic peptide, and with the resolution of symptoms of heart failure, the BNP levels decline. So, BNP levels greater than 400 picogram per ml indicates heart failure, while levels of BNP less than 100 picogram per ml indicates absence of heart failure. But plasma levels in between 100 to 400 may be challenging because BNP levels may be increased in other conditions such as chronic hypoxia, pulmonary embolism, pulmonary hypertension, and renal failures. So, BNP levels can be used to differentiate dyspnea because of heart failure from other causes of respiratory distress. Type C natriuretic peptide is secreted from the lungs, kidney, vascular endothelium in response to vascular wall stress. So collectively, the type A, B and C natriuretic peptides have protective actions and have beneficial effects in heart failure. So now let's look at the functions of natriuretic peptides. One, as the name itself is suggestive, they produce natriuresis and diuresis, decrease the salt and water retention, thereby decreasing the preload on the heart. Collectively, these natriuretic peptides are considered as a favorable form of neurohormonal activation. We have learned about the other neurohormonal mechanisms such as the renin-angiotensin-aldosterone system and the sympathetic nervous system activation. The long-term effects of these mechanisms are detrimental. They have damaging effects on the myocardium, on the vascular endothelium, on the kidney, producing structural changes and causing functional decline in the organs. Therefore, natriuretic peptides produce beneficial effects by causing antagonism of renin-angiotensin-aldosterone system, by causing antagonism of sympathetic nervous system, by causing antagonism of endothelin-1, which is a potent vasoconstrictor. It increases the systemic vascular resistance and increases the afterload on the heart. So, by antagonizing the unfavorable neurohormonal mechanisms, they provide beneficial effects in heart failure. Because of the natriuretic and diuretic effect, they reduce the salt and water retention. They also decrease the preload on the heart through inhibition of aldosterone and vasopressin, which are responsible for water retention, water conservation, and hypervolemia. So they decrease preload by inhibiting aldosterone and vasopressin secretion. They also decrease afterload by causing vasodilatation, by causing dilatation of the coronary blood vessels, by causing dilatation of the peripheral blood vessels. So they increase the coronary blood flow, decrease the afterload because of decrease in the systemic vascular resistance, increase the renal blood flow by increasing the afferent blood flow to the kidney. They also reduce ventricular remodeling by antagonizing the actions of angiotensin II, which plays a crucial role in proliferative and hypertrophic effects of cardiomyocytes and causing fibrosis in various organs. So, by reducing the actions of angiotensin II, the proliferative effects are reduced, the ventricular remodeling is reduced, the fibrosis in various organs is reduced. So now that we know about the protective actions of natriuretic peptides, peptides. Now let us learn about natriuretic hormone analogs, that is Nesiritide. Nesiritide is a recombinantly produced human brain natriuretic peptide that is approved by FDA for IV management of acute heart failure exacerbations in hospitalized patients. So it produces symptomatic improvement in acute heart failure. Do remember that its usefulness in chronic heart failure is limited. This is because of downregulation of natriuretic peptide receptors with chronic administration, and because of downregulation of the receptors, the effectiveness, the protective action and the benefit is decreased in chronic heart failure, and this limits its usefulness in chronic heart failure as therapeutic initiatives. Thus, Nesiritide is very useful in the management of acute heart failure but has limited usefulness in chronic heart failure. So how does the drug act? The drug binds to the receptors in the vasculature, kidney, adrenal glands and brain and overcomes the resistance to endogenous brain natriuretic peptides present in patients with congestive heart failure. Nesiritide administration has vasodilatory effect. It dilates the blood vessels of the peripheral circulation and coronary blood vessels, decreases the right and left ventricular filling pressure. By decreasing the systemic vascular resistance, the stroke volume increases, the cardiac output increases, and this provides rapid improvement of symptoms in congestive heart failure. Nesiritide in addition lowers the levels of aldosterone, catecholamines and endothelin and help in the symptomatic improvement in heart failure. Its effect on the kidney to cause natriuresis and diuresis, reduce salt and water retention, reduce the cardiac workload, improve the function of the kidney without any effect on serum potassium level and kidney function. Next is Angiotensin Receptor Neprilysin inhibitor, also known as ARNI. The drug is a combination of sacubitril and valsartan. So sacubitril is a neprilysin inhibitor. It inhibits neprilysin enzyme that is responsible for the degradation of protective natriuretic peptides such as A, B and C natriuretic peptides, increasing the levels of these peptide hormones. These natriuretic peptides provide beneficial action by causing natriuresis, diuresis, reducing the preload, causing vasodilatation and decreasing the systemic vascular resistance, decreasing the afterload, and by relaxing the blood vessels, the workload on the heart decreases, increases the myocardial performance and helps the heart to pump blood in the forward direction and supply blood throughout the body. So sacubitril, by inhibiting the neprilysin inhibitors, increases the concentration of protective neuropeptides and providing hemodynamic improvement in congestive heart failure. Valsartan on the other hand acts as an angiotensin receptor blocker and inhibits the actions of angiotensin 2, which plays a crucial role in increasing the preload, afterload, in causing salt and water retention and causing ventricular remodeling. So valsartan, by inhibiting the actions of angiotensin 2, decreases the cardiac workload on the heart, reduces ventricular remodeling, improves performance of the myocardium, reduces structural changes in the heart and the kidney and improves the performance of the heart. Thus, ARNI and angiotensin receptor neprilysin inhibitor offers the advantage of combining an angiotensin receptor blocker with a neprilysin inhibitor and is useful in the management of chronic heart failure. Now the question arises, can a neprilysin inhibitor be combined with an angiotensin converting enzyme inhibitor or ACE inhibitor? Now initially drug was developed by combining an ACE inhibitor with a neprilysin inhibitor and the drug was omapatrilat. This drug was observed to cause increased frequency of angioedema. So because of increased risk of angioedema as a side effect, ACE inhibitor was not combined with a neprilysin inhibitor and angiotensin receptor blocker was chosen to be combined with a neprilysin inhibitor. Therefore, sacubitril and valsartan is widely used in the management of heart failure, and omapatrilat, a combination of neprilysin inhibitor with an ACE inhibitor, was not marketed because of increased risk of angioedema. Some of the side effects associated with ARNI are dizziness, hypotension, hyperkalemia, and rise in serum creatinine levels. So these are some of the protective benefits of use of Nesiritide and angiotensin receptor neprilysin inhibitor in the management of heart failure. So if you find this video useful, please like and subscribe to this channel. Thank you for watching. Some of the common side effects associated with Nesiritide are headaches and decreased blood pressure.